Hello, my name is Omar Thomas, and today I will be making a presentation about understanding Alzheimer's disease. In the minutes ahead, we'll cover critical elements of Alzheimer's, its medical nature and history, as well as the personal experience of people with the disease and their caretakers. Alzheimer's disease is the most prevalent type of dementia, impacting around 60 to 70% of individuals living with dementia globally. In the United States alone, more than 7.2 million seniors are living with Alzheimer's as of 2025. Alarmingly, this number is projected to double by 2060 if we don't see significant advancements in treatment. These numbers highlight a pressing need for increased efforts in developing new medications and healthcare systems that can effectively support those affected by dementia and improve their quality of life. Alzheimer's is a debilitating and deadly disease. Besides killing people, it also cost society a great deal in financial and emotional terms. In 2023, unpaid caregivers provided 18 billion hours of care, which would have cost hundreds of billions of dollars if paid out. Furthermore, emergency room visits are high for patients, with many later requiring hospitalization. The expense affects not just individual patients, but it is a huge burden on the entire healthcare system. The hallmark of Alzheimer's is that it usually starts very subtle, with forgetfulness. People begin to forget recent events or even conversations. Other cognitive domains decrease with time, such as language perception, attentions, and reasoning. You may even notice some emotional symptoms, such as depression, anxiety, and irritability. As the illness advances, these deficits disrupt the ability to work, maintain relationships, and live independently. Up until now, we used to diagnose Alzheimer's disease based on the symptoms we observed with indicators as supportive rather than direct. Advanced imaging tests, such as amyloid and tau PET scans, along with blood and spinal fluid tests, can now establish Alzheimer's pathology earlier. With new blood-based biomarkers like tau fragments, the diagnosis is becoming easier. Machine learning is also being applied to increase diagnostic accuracy from brain scans. The disease is named after Alois Alzheimer, the German psychiatrist who first described it in 1906. He saw atypical brain changes, plaques, and tangles in a patient suffering from memory loss that followed a progressive course. Previously, there was no way to make a diagnosis except post-mortem. We've only just now been able to detect the disease biologically in life, and that has completely changed the way we see both diagnostics and research. Alzheimer's is a host of breakages in brain physiology. Atypical amyloid plaques accumulate between neurons, while tau proteins form tangles inside them, causing cell death. Inflammation, oxidative stress, and vascular damage are also involved in the disease. The first regions to be affected also tend to be the hippocampus, which is crucial for new memory formation. There are no cures for Alzheimer's at present, but some treatments can help manage symptoms. Cholesterol inhibitors and metamethine are frequently employed, and new anti-amyloid drugs have recently been approved that could slow the disease in people in its early stages. These treatments need a biopsy proving amyloidosis and cannot be applied for all patients. Research is now also broadening to include multi-targeted therapies, vaccines, and immune-based treatments. Beyond medication, lifestyle changes can be strong medicine. To date, exercise, a healthy diet, cognitive stimulation, and good social connections have been found to slow down a decline in the brain. There are also increasingly sophisticated assistive technologies, for reminder devices to AI-supported systems of care that can help alleviate caregivers' stress and workload. These therapies can substantially enhance quality of life, even in the absence of a cure. Living with Alzheimer's means learning to live with the increasing challenges of cognitive and emotional function. As identity becomes diluted, patients often feel disoriented in their new existence, being poked at from all some directions, and they never stop struggling for a foothold. But through helpful care, regular routines, and concentrating on what things you have left to do, such as habitual memory, many patients find joy and meaning in life. Family members and caregivers often suffer from emotional burnout, financial burden, social isolation. Still, some caregivers are finding that they have grown personally, having become more connected, and have found new ways of being. Support groups, respite care, and new technologies can help the experience of caring for someone with dementia feel less isolating and more manageable. Focusing on the well-being of caregivers is fundamental to the broader Alzheimer's care world. This is a list of some of the references that I use to do this presentation. And in conclusion, I just want to leave a closing thought. Alzheimer's disease is not only a medical condition, but also a profound social and emotional journey for everyone involved. Ongoing research is giving us hope for better diagnosis, more effective treatments, and greater support for patients and caregivers. Thank you so much for listening.